My name is Bridget Mogale. I'm the country manager for Illumina in Africa. I'm based in Johannesburg, South Africa. It is such a great pleasure for me to be here in Kenya, where we just hosted the first ever genomic workshop. I was overwhelmed by the support we received from the local researchers, from institutions, both in public and private. But most importantly, I was really inspired by the support we got from the ministries. That was really incredible for them to come and endorse what we have done in terms of expanding the adoption and the use of genomics in Kenya. How I see genomic applications, and particularly in human health, is around the area of infectious disease. And if I can give an example, as there's a proclamation from the WHO to end tuberculosis by 2030. This can only be possible with the use of genomics. Another area where I see the application of genomics is around the oncology space. People living longer, people having access to therapies that are relevant to them. We've heard today about the role of genomics in precision medicine. This is going to change the way physicians are able to offer care to their oncology patients. We have seen the impact of genomics, particularly in Africa, where there's at least more than 300 epidemics annually. We have seen how the power of genomics will help public health officials manage these outbreaks. One of our panels is what we call the viral surveillance panel. This panel is able to identify over 200 viruses of public health concern. For instance, you know that one of the countries, there was an outbreak of Ebola virus. It was through a technology like Illumina that they were able to identify which strain of the Ebola virus was circulating in the community. And only through the power of genomic sequencing, the officials were able to pick up what variant was circulating in the population. And only when they are able to identify which variant was circulating were they better able to manage and contain the virus in a smaller scale and ultimately stop the spreading of the virus. With the support of government that I really saw over the past 2 days, I really do believe that Kenya has all it takes to get genomics going and to better adopt its applications to manage and to take care of issues affecting Kenya. You have the scientists here, you have the technology here, you have the political will to adopt genomics. I particularly feel and personally feel that Kenya is well on its way to ensuring a better adoption of genomics and better manage issues affecting the Kenyans population. Really, my special thanks goes to 𝗜𝗚𝗂𝗂𝗂 to be able to afford us the opportunity to host this 2-day event. And of course, special thanks to FNS, our channel partner in Kenya, for really having worked with us in bringing this 2-day workshop, making a reality. It's really been a lot of work, and I don't think people understand what it takes to bring an event of this magnitude and we've had over 300 people across both days, and I really, really need to thank them, and together with the Illumina team, to making this a reality.